The GPs voted for GPC to quit working with the GP Forward Review plan unless money starts to come through. How would you go about doing that exactly?
Well, I think it's very clear that practices and GPs around the country are not yet seeing the evidence of the GP Forward Review delivering for them and for their patients. And this is something that we've been repeatedly concerned about over the last year. We do need to see evidence of practices seeing the benefits of the promised funding and all of the various different schemes that the GP Forward Review contains. It is very complex. There's far too many schemes and too many small pots of not recurrent money that is leading to lots of frustration, lots of bureaucracy, lots of hard work, but very little actually delivered. What we need is much of that funding consolidated, but above all, we need recurrent funding, because without recurrent funding, we can't make an expanded workforce sustainable. We need recurrent funding for more pharmacists, more therapists, more nurses, more GPs, and at the moment, the Forward Review doesn't promise that or commit to that.
How would GPC secure that funding?
Well, we have to engage with NHS England, with the government, and we have to convince them that it's in their interests to provide the recurrent resources, because without that, we won't have a sustainable general practice. We won't be able to deliver and meet the needs of our growing numbers of patients who have complex problems within the community. So we genuinely do need to expand the workforce. The government are committed to an expansion of the number of GPs and pharmacists and therapists. What they haven't done is provide the recurrent resources, and that's what they must do.